sometimes people go to physical therapy and it's not the best treatment for you. And then they go back to the doctor and they say, well, that didn't work. Well, did it? Or wasn't it really the right treatment? So you've been diagnosed with patellofemoral malalignment. What's really great PT? If you go to a PT, what should you expect? What should happen so you know whether it's good or not and effective? Because sometimes people go to physical therapy and it's not the best treatment for you. And then they go back to the doctor and they say, well, that didn't work. Well, did it? Or wasn't it really the right treatment? So what should you expect? The first thing we have to do is get our hands on your kneecap or your patella and mobilize it to change the anatomical position. That's possible. It's a sesamoid bone housed in a tendon. It can be moved, and it can be moved and held there as well. Then there's a lot of structures on the outside of your kneecap that if the origin insertion are brought closer together, then it shortens that tissue. So what we do is we mobilize that tissue and open it back up. So deep friction massage, lengthening that tissue will stop having an effect on an abnormal patella position. Then we have to work on the muscles in your leg, particularly your quads on the inside, that will help guide your patella and strengthen it in the right position in that intercondylar groove as you bend and straighten your knee. So those exercises have to be done with the physical therapy manually to make sure that they stimulate the right part of your leg against your foot, against your heel, in the right progression. You can't jump on a machine and straighten and bend your knees to make it happen. It won't, because you'll just strengthen all the muscles that are already strong. You have to strengthen the ones that aren't and the ones that are going to affect your patella position. After that, we have to address this is a multifactorial problem. It's not just a knee problem. It is affected your kneecap position because it's not a big stout, ball and socket joint like your hip. It's a little kneecap bone and it slides around in that groove. So everything is going to affect it. Your feet affect it, your hips affect it, your pelvis, your back, even your head and your shoulders. And so we look at everything when you come in to determine which things are affecting your kneecap. If your feet are toed in, that means you have internal rotation of your hips. That internal rotation of your hips is going to make your kneecaps go out, which is where we don't want them to be. If your feet are flat, or if you have pronated feet, your tibia is going to rotate, your femur is going to rotate, and it makes your kneecaps go out. Even a forward head and forward round shoulders puts compression more on your kneecaps than it does in the general position of your knee. So it's many, many, many factors. Maybe some of you have noticed that your knees go in a little bit too much. That's called valgus, knee valgus, or some people commonly call that knock-kneed. With your knee in like that, when your bones go in, your kneecaps go out. Again, not where we want them. Maybe you've noticed you're bow-legged. That too will affect the position of your kneecap. So all that needs to be addressed with your physical therapist. They should be looking at you from head to toe and making all those corrections. Then once we have your kneecap in the right place, then you want to make sure that you do strengthening exercises to keep it there. That will involve your foot, your ankle, your knee, your hip, your back. It will involve your whole body, particularly your glutes. You have to have really, really strong glutes and really strong hips to support your knee from above. That's really important. You want the stress and strain of activities to be taken with the hip. You want to make sure that any activities you do, the strain is taken in the hip, not your little knee joint. So those muscles have to be really strong. Then what we do is your knee doesn't hurt anymore. You can do stairs, you can do all the things that you want to do, but I want to go play tennis. All right, let's get you ready for tennis. So now then the next phase of physical therapy should be sports-specific training and getting you prepared for those positions for whatever your knee's going to have to go through. Done correctly at any age, we can get rid of this pain for good. Because once your knee goes back into its normal position and tracks properly, it wants to stay there, but everything else has to be in alignment and supportive of your knee. Get to a good physical therapist, have them help you do all the activities you want to do in life, and get rid of your patellofemoral pain for good.